Mr. Speaker, I would like to present today to this Honorable House a progress report on the rollout of COVID-19 vaccination program in Bermuda. As we are all aware, COVID-19 continues as a public health emergency for Bermuda and the rest of the world. In response to this deadly pandemic, research and trials of new vaccines were accelerated through 2020 and continue at a fast pace into 2021. Worldwide, as of the 4th of March, there are 42 vaccines formally entered phase 1 of development, where they are tested for safety and dosage and to confirm they will stimulate the immune system. A total of 27 vaccines has expanded into phase 2 safety trials, where the vaccine is tested on hundreds of people in varying groups to see if the vaccine acts differently in the differing groups. This phase further tests vaccine safety. 21 vaccines are entered in phase 3 of development, which comprises the large-scale efficiency test. In this phase, many thousands of people are vaccinated to determine if the vaccine protects against the coronavirus. These trials are large enough to reveal even relatively rare side effects as well. After going through all 3 phases, vaccine makers can apply for authorization for use. To date, 6 vaccines have been authorized for early or limited use, and this is what we refer to as emergency use, and 6 have been approved for full use by different authorities around the world. The Office of the Chief Medical Officer, in conjunction with the Bermuda Advisory Committee on Immunization Practices, provides guidance on the implementation of the COVID-19 vaccine in Bermuda. Bermuda's vaccine program is aligned with the advice, authorizations, and approvals issued by the Food and Drug Administration, Canada Health, the European Medicines Agency, Public Health England, and the World Health Organization. Currently, Bermuda is executing its vaccine program using the Pfizer-BioNTech vaccine, one that is probably at the forefront in terms of being authorized for use in the greatest number of countries. Mr. Speaker, as initially reported to this House in December last year, Bermuda has a disproportionate number of elderly and vulnerable residents due to chronic conditions like high blood pressure and diabetes. We do not have a young population, so the need for the vaccine here is even greater than in some other countries. Using census data, the ministry produced an allocation plan to assure that the most vulnerable receive the vaccine first, along with the healthcare professionals who are on the front lines and who care for these vulnerable persons. So phase 1A targeted people who are 80 years of age or older, rest homes and long-term care facility residents, healthcare workers, and workers providing essential services such as border control, police, firemen, and those are in the corrections services. Phase 1B targeted people who are 65 years of age or more, as well as persons who are extremely vulnerable, such as those undergoing chemotherapy and those with lupus, severe asthma, and severe COPD. Currently, Mr. Speaker, we are targeting the population group in phase 2, which is people who are more than 50 years old and medically vulnerable people with conditions such as heart disease, chronic kidney or liver disease, and diabetes. We are also developing solutions to reach certain identified groups, for example, people who are less mobile, residents living with diabetes, and unsheltered persons. Excuse me, Mr. Speaker. The final phase, Mr. Speaker, will be everyone, which is phase 3. It is critical that as many people as possible get vaccinated. Some believe that actually getting COVID-19 will provide a natural immunity and will consider this to be sufficient. It is not. Experts, Mr. Speaker, do not know how long this natural immunity lasts, and the risk of severe illness and death from COVID-19 far outweighs any benefits of natural immunity. The COVID-19 vaccination will help protect you by creating an antibody response without having to experience more than mild side effects, such as a headache. It will also help you to protect the loved ones around you and the community generally by creating a dead end for virus transmission. Furthermore, immunity as a result of vaccination has been shown to be superior to immunity from natural infection, as it is stronger. Mr. Speaker, in terms of progress to date, we administered 20,705 vaccinations between the 11th of January, when it started, and February 27th. the most recent reporting period. This number increases to 23,939 if you include the first 3 days of the current reporting period, namely March 1st to 3rd. Bermuda's goal of herd immunity will be achieved when 70% of our population, which is 64,054, has been immunized. Up to and including March 3rd, 23% of the population has been vaccinated with 1 dose, and 13% of the population has been immunized with 2 doses. If you take into account just the percentage of the population which is eligible for the vaccine, for example, persons over the age of 16, we have vaccinated 27% of the eligible population and immunized 16% of that population. And Mr. Speaker, this is very good news. Mr. Speaker, while the vaccine rollout has not been without its challenges, I am very pleased to report that the ministry's vaccine allocation strategy was the correct plan of action. Vaccinations by age group shows that the targeted approach has been successful, with seniors, all those 65 or more, having been vaccinated at approximately 50% of those. Specifically, of those aged 80 years or more, our most vulnerable population group, 55% have had the vaccine immunized, 16% of that population. And Mr. Speaker, this is very good news. Mr. Speaker, while the vaccine rollout has not been without its challenges, I am very pleased to report that the ministry's vaccine allocation strategy was the correct plan of action. Vaccinations by age group shows that the targeted approach has been successful, with seniors, all those 65 or more, having been vaccinated at approximately 50% of those. Specifically, of those aged 80 years or more, our most vulnerable population group, 55% have had the vaccine administered, 41% have had 1 shot, and 14% are fully immunized, having had 2 shots. Similarly, in the age groups of 65 to 79, 31% have been vaccinated and 17% are fully immunized. The ministry's community outreach team will be working to reach those seniors with barriers, and the ministry's partnership with Age Concern is a great first step. We recognize many in this age group of 65 plus do not have access to the technology and or to computer literacy needed to complete the registration form, and we are working to overcome this barrier and get more of our most vulnerable vaccinated. Mr. Speaker, Bermuda's ability to achieve herd immunity depends on 2 factors: a community's willingness to be vaccinated and a steady supply of COVID-19 vaccines. Vaccines are effective. They work. Data being reported from around the world shows that countries like Bermuda that have implemented aggressive vaccination programs are now seeing decreases, and in some countries dramatic decreases, in the number of persons infected with the coronavirus and the numbers hospitalized. Mr. Speaker, Bermuda has 2 sources of procuring vaccine against COVID-19. The primary source at the moment is through the Foreign Commonwealth of Development Office, which is being facilitated by Government House and by direct talks between Chief Medical Officer and Public Health Italy. So far, Bermuda has received 28,750 doses of the Pfizer vaccine from the UK, and a third shipment of 10,500 is meant to have arrived last evening on the BA flight, which would give our total of 39,250. Mr. Speaker, the second vaccine source is through Gavi, the Vaccine Alliance Geneva, which is administering the COVID-19 vaccine Global Access Facility, or the COVAX facility. Bermuda has joined the COVAX facility and has purchased approximately 26,400 doses of the AstraZeneca vaccine. Unfortunately, Mr. Speaker, the time frame for receipt of these vaccines through the COVAX facility is not yet settled. We expect to receive 25% of the doses in the first quarter of this year, with the remaining 75% not being received until later in the second quarter of the year. Mr. Speaker, we base our projections for vaccine use on the confirmed and committed doses we have in hand and will receive, such as the ones I referred to last evening. As such, Mr. Speaker, we only count the 39,250 doses of the Pfizer vaccine when we state that Bermuda's first dose date will be in mid-March based on current supplies. The COVID-19 vaccination, Mr. Speaker, is voluntary, but it is already clear that the travel industry is aggressively assessing how immunity can provide it with new life. As I have previously reported in this House, the International Air Transport Association is working on a travel pass to enable the safe sharing of COVID-19 test results and vaccination certificates across borders. This is one of many app developers. To manage expectations here in Bermuda, it needs to be clearly reiterated that the desired result of these first phases of vaccination is not to end the pandemic, but to protect our healthcare workers, our most vulnerable people in our community as well, which are the elderly, and to prevent our healthcare system from being overwhelmed. We acknowledge and agree this pandemic can only end when all people in all countries of the world are vaccinated, and this is our reality. Mr. Speaker, the important vaccination rollout work is not being done by the Ministry alone. In addition to the Ministry of Health staff who work between testing and contact tracing and contact case management, often in addition to their day jobs as community nurses, we have welcomed the necessary assistance of the Bermuda Hospitals Board and its staff, general practitioners, advanced EMTs, dentists, vets, and retired nurses. As Minister and on behalf of the Ministry, I cannot thank these professionals enough. Their dedication to the island's well-being is truly stellar. Mr. Speaker, nowhere was this more evident than this past Wednesday when an excess of vaccine doses needed to be used immediately. In response to our call to avoid wastage, hundreds of residents responded by waiting patiently in the rain for their first dose, and the health professionals and administrative staff worked 12 to 14 hours that day to get the job done. And I applaud and thank them all for their incredibly hard work. Mr. Speaker, in closing, wearing masks, physical distancing, good hand hygiene, and downloading the We Health app are all important in our fight against the coronavirus. But these measures are not enough. Vaccines will work with your immune system, so it will be ready to fight the virus if you are exposed. We urge everyone to get vaccinated when it is your turn. The combination of getting vaccinated and following the Ministry of Health's guidelines on how best to protect yourself and others will offer all of us the best protection from COVID-19. Thank you, Mr. Speaker.